I see a lot of young people now who don't have the tools that they need, they're struggling and things like that. So I thought, what could I do to help young people, to give them, young women especially, to give them the same opportunities that I had. A couple of weeks after B came, I was thinking, you know what? I don't see a lot of African Americans in that role. I mean, you go to hospitals, you see them in doctors, you see them, there's a lot of minorities working in hospitals, but not in the leadership roles. I mean, I've been here 28 years. I don't know how many African American CEOs there are. There were 2 I remember in 1988 because we talked about it. So for 90 years, HANYS has had male leadership. And so the thought then about a scholarship for someone to study public policy never came to mind. So this one day, we're in the kitchen and I'm talking to Darren Dopp and Dr. Streck, and we were talking about making an impact on the world. And I said, wouldn't it be great if we found an African American version of B? So they're looking at me like, oh yeah. So Darren says, you know what? You want to do that? I'll help you write it up. About 2 or 3 days later, B comes by my desk and she said, I understand you have this idea what you want to do. I'd like to be involved. I'd like to hear more about it. And I never realized that I would get that much support from HANYS. That was the shock. Because it was just an idea for me. And then when we started thinking about it, I thought, wow, she's really interested. She's interested in minorities in the C-suite. Maybe I can give back to HANYS what HANYS has given to me. The School of Public Health, where we're donating setting up the endowment, seems to have a lot of students who are doing well. We have maybe 8 or 10 here at HANYS, and there's minorities in that group. And it seems like once they get here, their career takes off. They realize this is a place where they want to be. So I'm hoping that through the scholarship, once they award the scholarship, then they'll ask the students to do an internship. And we're hoping that that internship will be done here at HANYS. And because a couple of people here at HANYS have said to me, I didn't get the idea for my career, what I really wanted to do, until I spent an internship here. In fact, we always laugh about the one person who helped me get this over the finish line was Nick Henley. Nick Henley came here as an intern. He's a vice president now. And he was really, he bought into this idea early. We were having a series of meetings, and finally Nick said, let me help you. And he met with with SUNY and all of that. So and he could see a vision too. He was like, let's do this. 10 years from now, if we get this scholarship going, if we get this endowment, and we get it funded at a certain level, we could have 4 or 5 interns here at HANYS. He saw the possibilities, and that was really helpful to me. I was teasing B one day. I said, okay, we'll give you 20 years on the job, and then we'll be ready. I don't know whether it'll take 20 years or not, but I just know we're anxious to get started. And I'm hoping that more women will see the opportunity for not just, working in the hospital, but for leadership roles in healthcare policy. Because I don't think a lot of women have thought about it. When the other day I had lunch with some SUNY representatives, and they were saying that they are now going to begin to talk this up to what they call underrepresented populations. They're going to begin to talk this up and get people thinking, maybe I can do that. Maybe I don't have to be a doctor. Maybe I don't have to be, a nurse. Maybe I can just do some clinical and eventually get into healthcare policy. So maybe 10 years, I have no idea. We're just anxious to get started.